12:25 on this Monday, and boy, we got a blast of winter, and now we want to go outside and do outdoor sports. But you know, when we head outside, the snow and the ice can be pretty dangerous. Ironically and coincidentally and appropriately, January is National Winter Sports Traumatic Brain Injury Awareness Month. That's a mouthful, but it's really about think before you go out so you don't get injured. Dr. Marc Underhill from Northwest Radiology joins us, and we want to talk a little bit about the injuries that he sees coming into the office, some of the dangers of winter sports, and what we can do to make sure that we're not your client.
Exactly. But if you have to be, we're happy to scan you and take care of you.
Happy to help us. All right, so let's talk about some of the dangers of winter sports and what you see coming in.
It was a busy weekend. Normally this time of year we tend to slow down a little bit, but with the winter storm, kids are out having fun, which is a great thing. Kids being out and active is a great thing. But what we see is a lot with the extreme sports. People have a lot of head injuries. Barreling down the hill at 25 miles an hour, whether you're on a snowboard, ski, sled, a lot of times you should be wearing a helmet.
That's right. And if you're not, you could get a traumatic brain injury, and there's a variety of different levels of what a TBI is.
Correct. The basic ones, the ones we're most familiar with coming from the NFL, are the concussions. Step up from that is the coop, counter coop, and then the contusions, and a contusion is just a bleed in the brain.
Okay, but you don't want any of them.
No, you don't want any of them.
All right, now when we're trying to determine you've hit your head, something's wrong, we're trying to make a diagnosis, what are the different ways that that can be done? What kind of tools are used?
Perfect. You definitely want to consult a healthcare professional. They're going to start with a basic examination, cranial nerves, testing, things of that nature, but then it goes and relies a lot on imaging. And we start with our workhorse for initially is our CAT scan or CT scans. MRIs are definitely used to answer a specific question, but it's going to start off typically with your CT scan to start off.
And do we need to go to the emergency room for this? I mean, it's always so hard, you know. It's like, okay, we've had a sledding injury. Where do we go?
A lot of times, yes, if it's an acute injury, an ER is the perfect way to start. If you're noticing it later on, seeing your primary care physician or other healthcare professional is the way to go.
Your key tips for prevention?
Be smart, notice your surroundings, don't overextend yourself. If you've never been snowboarding before, try not to do that backflip before you learn how to go down the bunny hill. And then wear a helmet. If you've cracked your helmet, get a new one and make sure that helmet fits. A lot of times that helmet we have for riding the bike in the summer doesn't always fit when you're wearing a hood or a ski hat.
That's right. And also, I'd like to say, you know, parents, go out and supervise your kids. Don't just send them out there, right?
Absolutely.
All right. And parents, if you're joining them, limit the alcoholic intake.
Always a good idea.
Yeah. Then you can think that you're a lot better skier than you actually are. Okay, Dr. Marc Underhill from Northwest Radiology Network, thank you so much for joining us and reminding us that while it's beautiful, it also, we have to maybe have an antenna up for what can happen next.
Always be smart.
All right. Thank you. All right, Sean, did you get out and go sledding over the weekend?
No sledding. We did